Zoom conference organized by International School of Disability Studies, Abuja, Nigeria. My topic of presentation is accelerating inclusion of children with disabilities by combining strengths of CBR and social work approaches. The lessons are from Community Based Rehabilitation Students in Uganda. My name is Denis Nuwagaba. The facts about Uganda and disability. Uganda is located in East Africa. Uganda has a population of 45,741,007. Disability prevalence is estimated at 12.4%. Children with the disability are around 2.5 million. People with disabilities experience a lot of stigma and discrimination in society, Uganda inclusive. Children with disability are more vulnerable and marginalized in most of our communities. It is very important to note that Uganda has rich disability policies, but implementation remains a challenge. The purpose of study was to assess challenges faced by families and children with disabilities. The study made an inquiry into the potentials of combining strengths of CBR and social work approaches to build resilience. It is very important to first understand social work and community-based rehabilitation. Social work is an area of study and profession that deals with individuals, families, communities, and groups to enhance social functioning of society and well-being. While community-based rehabilitation is a practice aimed at enhancing the quality of life of people living with disabilities through combining efforts of people living with disabilities themselves, their families, organizations, communities, government, and other relevant stakeholders. Disability inclusion, on the other hand, involves creating opportunities for everyone, regardless of their disability status. Though this is still very far from reach, despite the supportive legal environments that we have. While social work and community-based rehabilitation are very strong models individually, the integration at academic level and community practice levels can have a triple effect towards disability inclusion, but we realize that this has not been fully harnessed. We are far from reaching the expectations. These are social work theories on slide 1 and the CBR approaches on slide 2. Study methodology we adopted. Study design, we adopted participatory learning and action using CBR approach. The target population, we targeted 30 families in Mukono district, one of the districts that neighbors the capital city, Kampala. Data collection methods, we used in-depth interviews, observations, taking action using local available resources, and referrals to partners who deal with disability. Findings, we have type of disability, a number of children with disability, and these are the key issues. The grandmothers, we realized that were shouldering the burden of care for children with disabilities. Men had abandoned spouses and their families because of disability. There were very weak referral linkages for services to children with disability. There were knowledge gaps on how to manage different types of disability. And these families we visited were living in high levels of poverty. In addition, children were not enjoying their rights. Children with disabilities and their families were facing exclusion from enjoying their rights due to superstition, neglect, negative attitudes, negative social norms, and practices that made them excluded. There was limited funding at all levels when we interacted with different institutions in the community. There was lack of functional CBR. The frontline workers and stakeholders lacked skills on how to integrate disability in their day-to-day work. In conclusion, there was limited social work and CBR integration. The findings suggest that to achieve disability inclusion, we need a hybrid model that integrates social work and community-based rehabilitation approaches. This should be explored to reduce stigma and discrimination. However, because the study was just a small drop, there is a need for further research to develop more evidence to inform the practice of disability inclusion using these two important models, CBR and social work. Children needs were not being met because of lack of funding and lack of integration. We suggest that there is a need to increase resource mobilization for targeted funding of programs and services for children with disabilities and their families. There is a need to maximize supportive legal frameworks like Convention of Rights of Persons with Disabilities and build on sustainable development goals, which is very disability-friendly platforms to increase awareness on disability rights, inclusion, and build skills in management of different disabilities and frontline workers to deal with disability. At this end, I acknowledge all contributors for this that made it possible to present this paper, and also International School of Disability Studies in Abuja, Nigeria, for organizing this online event, which has made it possible to share our experiences. Thank you very much.